Good afternoon, everyone. Welcome to the Nat Health Leadership Outreach Series for our frontline workers. This program is meant for advice, counseling, and support to our frontline heroes who are responding every day amidst the COVID pandemic. To talk a little bit about the program and what we intend to do, it's my privilege to welcome Dr. Harsh Mahajan, President, Nat Health, into the stage. Over to you, Dr. Mahajan, for your introductory remarks, please. Thank you.
Thank you very much, Siddharth. Good afternoon, everyone, and welcome to this first of a series of interactions, talks in these pandemic times where we all are feeling the brunt of this disease, personally, at work, at home. And this is an attempt by Nat Health, the Healthcare Federation of India, a program which is conceived as a forum where global leaders and global mental health experts interact with frontline workers. The idea is that we answer questions that are asked by you, resolve issues, identify areas where Nat Health needs to intervene, pick up ideas and great examples, and popularize good practices. This is not going to be a one-way street. It has to be two-way. We also need to learn from you, from your questions, from your comments. So please feel free to interact, because we are not the fountain of knowledge. We all need to learn from each other. Here, we would also like to talk about safety and join hands to discuss challenges around patient safety, health worker safety, individual safety, discuss challenges, individual well-being, and charter a course where we can manage the situation with science and evidence. Also, some of us can be like big brothers and sisters to you, those who are young amongst the frontline workers, where you may come and discuss your problems that you face on a day-to-day basis. And of course, we would recognize key contributions from our frontline heroes. Now, for the first in these series, I have a proud privilege to present a dear friend, one of the doyens of the industry, a very fine doctor, a fine management expert, a fine human being, Dr. Sudarshan Ballal, who's the chairman of the Manipal Hospitals Organization and is also past president of Nat Health, the Healthcare Federation of India. A word about him: he was the best outgoing student, Blue Ribbon awardee of the Kasturba Medical College, Manipal, and a recipient of many gold medals in MBBS and MD. Later, he had his further training in the US and has the distinction of being one of the few to be triple board certified in internal medicine, nephrology, and critical care. And internal medicine and critical care are playing a huge role in this pandemic. He's recently nominated as member in the board of management in Manipal Academy of Higher Education. And he's the first one to set up a training program in nephrology in the state of Karnataka and as way back as 1999, and trains the largest number of nephrology postgraduates in Karnataka. His list of awards and recognitions is huge, but I'll just name a few. The Raj Yog Swasa Award 2005, Aryabhata International Award 2010, Dr. B.C. Roy Award 2010, Namma Bengaluru Award 2010, and many, many more. He has, of course, numerous publications in national and international journals, And Dr. Ballal has been actively involved in many corporate social responsibilities through his family trust named Messrs. Belanje Sanjeeva Hegde Trust. Over to you, Dr. Ballal, for this first in a long series, I hope, and we could have found no one better than you to start this. Dr. Ballal,
At the
please.
outset, thank you very much, Dr. Mahajan. You indeed are a dear friend for the very generous introduction. I would like to thank Dr. Mahajan, the current president of Nat Health, the Secretary General Siddhartha, and the team of Nat Health for organizing this very, very important interaction. It's truly an interaction between our frontline warriors and the people who are sitting in their offices like us. And we need to know what is it that you're going through? How is it that we can work together to make your life more comfortable? The tsunami of Corona was totally unexpected, and unfortunately, we were not very prepared for it. The sheer numbers, the ferocity, and the rapidity of the spread took the world and us by storm and has left us literally gasping for breath. And but for all of you, we would have been in dire straits. And before I start anything, from the bottom of my heart, a big, big thank you to the great Corona warriors who have saved the country for us. With these few words of introduction, I would like to talk about what is happening in the healthcare industry in this second tsunami of Corona. Obviously, it took us by storm. The numbers went up exponentially from something like 10,000 cases a day to about 400,000 cases per day in a matter of few weeks. And deaths also rose to about 4,000 deaths per day. And the huge need and the surge for beds, oxygen, ICUs, medications overwhelmed the system rapidly because no one had expected this kind of a rapid surge in these kind of numbers. However, I think we still have hope because many countries which have gone through this, like many countries in Europe, England, and America, went through similar surges. In fact, if you look at the statistics, their stats were worse than ours, but now have come out of it. And America and some parts of Europe have now let their masks down, literally, and have allowed people to walk around without a mask. And of course, they do recommend social distancing, masking in special situations. But for the common man, I think they're almost back to the freedom we had almost 18 months ago. Hopefully, we together will fight this out and conquer Corona, but should not let our guard down, which is a mistake we made the first time. And hopefully, we don't repeat the mistakes. And also be fully prepared for the third wave, far better than what we were for the second wave. So since this is an interactive session, I won't say very much. I would rather have you ask the questions and answer whatever I could. With this, I open it for discussion. Siddhartha, back to you.
Thank you, Dr. Ballal. Thank you, Dr. Mahajan, indeed. We had reached out to the frontline workers with a questionnaire. Sir, in terms of, I'm just going to summarize some themes first, and then we'll go to some specific questions if you would allow. The first, broad set of questionnaires really comes around the coronavirus, especially the working in intensive care units. Every case is unpredictable. And there is always a pressure, and the pressure over a protracted period turns into fatigue. As a doctor, from your experience, Dr. Ballal, how would you advise the frontline workers cope with the current stress and the fatigue that is building up since last year? What are some practical advices that you have in mind for them, please? Thank you.
No, I think you have chosen the right question, Siddhartha. Over the last 50 years of my practice of medicine, I have never seen anything like this as stressful to the frontline workers, the doctors, the nurses, the paramedics, so on and so forth. It is really stressful. It's not just physical stress. Many people have been working 24/7 for weeks together now just to cope with the sheer volumes of sick patients that get in through the ER, to the HDUs, to the ICUs, so on and so forth. It's also mental stress. you see so many patients becoming sick and unfortunately some of them dying. One other stress which I think many people had not seen during the previous effect of corona is that now we have this helplessness. I get hundreds of calls every day saying my mother is sick, my aunt is sick, I am sick, they need an ICU bed urgently, otherwise they will die. And unfortunately, they do die because we are not able to provide them oxygenated beds. We are not able to provide them ICU beds. And that has been the hardest thing for me. People waiting in ambulances, people waiting at home, people waiting in the ER, intubated, but nowhere to go. And some of them die at home, some of them die in the ambulance, and some of them actually come to the ER and then are sent home because there's no bed anywhere. This is the hardest part for me because you are allowing a person to die in your doorstep, very well knowing that if you had the means, you could save that life. This is almost like you're acting God, saying you live, you don't. And that has been the most difficult part for me. And I'm sure the frontline workers would face it a lot more. But a person who's been receiving numerous calls every day, I think that's been a very hard part than the actual physical and mental trauma of taking care of sick patients. So obviously this drains you physically and mentally. And I've seen some of the most aggressive, very vivacious, active, proactive intensivists actually go into depression. So we do a lot of counseling for them. And we also talk about the good news, saying that this is a temporary phase. This too shall pass. And we have seen that happen. And I'm being honest when I say this too shall pass. I made a prediction about 2 or 3 weeks ago. By 15th to 20th of May, we'll see a significant downward trend in Bangalore. And from a peak of 25,000, we have come to about 8,000 now, almost a 60% drop in the numbers. And I'm hopeful that this will continue. But believe me, this will depend mostly on human behavior, not on the medications, not on vaccines alone, but human behavior. If we are careful, we can drive corona away or at least keep it at bay. So I think that is one part of the good news, that this is a temporary phenomenon. We'll get over it with the right human behavior, right vaccination, so on and so forth. The second thing, which is vastly different from last time, is when this disease first came, we didn't know anything about the disease. It was absolutely a new virus, new disease. We didn't know what it causes, how it spreads, so on and so forth. And unfortunately, a huge number of the medical, paramedical, and nursing fraternity and the healthcare workers in general succumb to the illness. I've known some friends, nephrologists, both in Bangalore and outside of Bangalore, actually die of severe lung failure waiting for a lung transplant. So that was the tragedy last time. In our own hospital with over 7,000 or 8,000 workers, we had about 17 to 18% of our workers actually getting infected. A fairly large number got infected, and that is true of many other large chains that I'm aware of. Fortunately, we didn't lose anyone, and we, of course, took care of all the people who got infected, and thankfully, all of them walked home. However, what is vastly different this time is out of this 7,000 or 8,000 people we have, not more than a handful, less than a dozen have been infected this time. So this speaks volumes of our measures to prevent the infection, at least in healthcare workers. I think two things we have learned. One is personal protection. I think that was not being followed nor known very well during the first time. And now I think everyone is very, very clear that if you have to deal with COVID, take it that everyone that you see has COVID. Like the universal protection which started with AIDS or HIV, where you said any person there, blood is probably infected, so you have to take universal precautions. So also now we recommend that you take universal precautions of anyone you see. Take it for granted that person might have COVID. So I think a lot of personal protection, maybe different grades, like an N95 mask, goggles, visors, and a full PPE for people who in the forefront, like ICUs, anesthesia, ER, so on and so forth. That is one aspect. The second aspect is, fortunately for us, we did get the vaccination quite early. We started our vaccination program in January of this year, and we were successful in vaccinating more than 90% of healthcare workers. So I do believe this combination of personal protection, precautions, plus vaccination has prevented a large number of people from getting infected, and also less people infected, less morbidity and less mortality. That is certainly the silver lining in the cloud of corona. So one is we know the disease better. We have taken better protection. We have less number of people infected. But the downside is the numbers of people that we are taking care of now is huge. And like what we did last time, we have recommended a shift system so that no one person or one team is totally burdened. They get at least some time off, maybe 3 days, 6 days, 7 days, where they can have time for themselves, for their family, relax, have a normal sleep pattern, normal food habits, which also will go a long way in maintaining their mental balance. I think all these put together, where we take enough precautions, vaccinate people, follow the universal precautions, give them time off during this busy schedule, and constant counseling has helped us in keeping the physical and mental health of our healthcare workers. But in spite of that, I must congratulate the frontline workers, and not only the frontline workers, but also their families for putting up with this, because everyone is not only concerned about himself or herself, but also what happens to my child, my wife, my family, my parents at home when I go back. Am I going to carry the virus? So these are some of the issues that will constantly nag you. And hopefully, with the kind of measures we have taken, we'll have some solution in the near future.
Thank you, Dr. Ballal. I think you have already, so you answered really the question in terms of the stress and the fatigue levels. In terms of protecting the healthcare workers and their family, also you've answered a lot of the, your suggestions are very well taken. So do you foresee a need for additional vaccination? Some questions have come in. As the virus mutates, is there a need for continuous vaccinations? Are there certain drugs, therapeutics that will preventively fortify any sort of infection among frontline workers? What are some of your thoughts and opinions around that? Thank you.
Well, I think our opinions have changed with times. A lot of hype for hydroxychloroquine, zinc, vitamin D, vitamin C, immune boosters, so on and so forth. But this has not been proven by science, and I don't think there's any real role now for any prophylaxis other than the precautions, that is COVID-appropriate behavior, masking, distancing, hand washing, avoiding crowds, and of course now vaccination. I don't think there's anything else that can prevent the disease. The two forms of vaccinations, one is under your control, masking, distancing, hand washing. The other one is the vaccines that are currently available. Other than these, I don't think, I guess there's no harm in taking some vitamins and things like that, but I don't think we should take it as preventive measures for COVID. The only prevention is avoiding the virus and also boosting your immune system by the vaccination. And I do believe that we will get over this virus. It's just a matter of time. But the problem is we don't learn from our mistakes. I think the negligence of our citizens and also people who are running the system led to this disaster. If we were more careful, didn't pat ourselves on the back and say we have conquered COVID, we had the least mortality, least morbidity, we would have been better prepared for the second, because everywhere in the world and everywhere in history, right from 1914, we knew that viral pandemics just don't vanish. They keep coming back in cycles, and we are smarter than the virus, hopefully, and we can manage these cycles better if we are prepared to address these cycles. Unfortunately, we let our guard down. We didn't wrap up our healthcare system. We didn't implement COVID-appropriate behavior. And of course, we started vaccination with the right earnest, but we didn't follow it through. I think our vaccination after the first and second phases of healthcare workers and frontline faltered. We opened up vaccine for different categories, but didn't have production lines, supply chains. So I think the vaccination drive is now faltering. But fortunately for us, the government has come up with many different means of either procuring, ramping up production, and importing vaccines. And hopefully we'll be back on track in the next month or so. But I think it is important that we keep one step ahead of the virus. Otherwise, the virus will overtake you and you'll lose the race. And that is my important message. Even after we control the second cycle, please be prepared for the third wave and take measures to blunt the third wave right now. So no role for any prevention other than COVID-appropriate behavior and vaccination. All the rest have not stood the test of scientific scrutiny. There's no harm in taking some vitamins, D, C, zinc, so on and so forth. But I don't think you can take it as a protective measure for the COVID virus. The only protection is the preventive measures you take and the vaccination. And please, please do not let your guard down with or without the vaccination.
Dr. Ballal, thank you, sir. The next question is really around where is this virus headed? I know we talk a lot about wave 2 waning down, wave 3 around the corner. As the virus changes its shape and direction, what will be the how will the wave 3 really look like? The other question is also around how do we take care of the non-COVID patients at a time when COVID is really ramping up. There is the entire non-COVID load has not gone away. And what is the best way to manage the needs of both the COVID and the non-COVID segments?
These are some very important questions and also something very close to my heart. I'll address the first part of the question, which is, will the virus mutate and will we need booster doses? I think history has taught us that the viruses mutate, not only the COVID-19, but every other virus mutates when it replicates for various reasons. And we have also found that most vaccinations, you need a booster dose. And we have seen that with a common example being influenza. We take a booster dose every year. And based on the fact that the virus mutates, every year it's a new vaccine. So I will not be surprised if we have to take a corona vaccine every year, every 8 months or whatever. And it is a given that we'll have to take the vaccinations repeatedly. How often is something that the medical experts are yet to decide. Most people believe the immunity may last about 8 months to 12 months. So I'm fairly certain that we'll have a vaccination at least once a year. And obviously, based on the number of mutations and how the mutations behave, there may be a change in the way the vaccine is manufactured and delivered, like what happens in the flu vaccine. So these two are a given, that the viruses will mutate, the vaccination will have to be repeated, and whether the same vaccine or whether it is a vaccine that's modified for the mutation is something that time will decide. So I don't think there's any question on that. But my biggest concern, both during the last wave of corona and the current tsunami of corona, was that what do we do with non-COVID patients? And this is a tragedy of sorts. I really, really feel sad for the patients with non-COVID illness because COVID has taken center stage. There is nowhere to go for patients with non-COVID, whether it's cancer, kidney disease, heart attacks, diabetes, hypertension, lung disease, so on and so forth. I've actually physically seen a lot of patients move from stage 2 of cancer to stage 4 of cancer. People with CKD going on to end-stage renal disease, dying because they cannot go for dialysis. Many dialysis centers are closed and they are unable to travel because of lockdown. This is an unbelievable tragedy, but no one talks about it very much because corona has taken center stage. We have to take care of every life. Corona life and a non-corona life to me is the same. Any person dying because of lack of medical care is the same, whether it is because of corona or non-corona. And this is something that the healthcare experts, both in the private sector, public sector, and the government should take notice of when we sort of plan the future of the health of this country. Unfortunately, health had taken a back seat for almost 70 years after our independence. It's only after the corona pandemic that health sector has been given some importance that it richly deserved. And hopefully, the planners of the country and also the healthcare givers of the country will in the future plan for both pandemic care and non-pandemic or non-COVID kind of care for the future hospitals, because we cannot sort of say, we'll only take a corona, non-corona, please get out of the hospital. So this is not on, and this is the tragedy of corona. You have killed due to corona, and have also killed a lot of people because non-corona care almost is non-existent in the country now.
Thank you, sir. I think the implication of what you just mentioned is the wave 3 and the wave 4 may not only be a corona wave, it could be a corona and a non-corona wave that is building up as we speak. I think the next question is really around skilling and capacity building. So there are two questions here which are tied to each other. One is from a frontline manager whose question is, what sort of additional, what's the way I motivate my team who is, providing these very critical services? What are the tools, techniques, and the training that, I need to undertake? And the second question is, the disease is now spreading from really the urban and the peri-urban into more rural parts of the countries where you don't have the same level and the density of infrastructure or skills that are required to deal with it. What are some of the transferable practices and the trainings that can be done and to rapidly adapt to the evolving scenario for this?
Sure. So many of the things that you have mentioned is something that has to be a long-term issue. We cannot ramp up any healthcare system going from 1,000 beds to 10,000 beds in a matter of weeks. Even if we go from 1,000 beds to 10,000 beds, manning these hospitals and the required personnel is almost impossible. So this has to be a long-term planning. Unfortunately, what happens is we forget as soon as the disease goes away, we forget that this can happen again. We should have a continuous process of ramping the healthcare system, not only for this pandemic, but also for future pandemic, and also the tsunami of non-communicable diseases. India had more non-communicable disease deaths than communicable diseases till Corona hit the scene. So we cannot ignore that. So I think we have to ramp up our healthcare system. And unfortunately, most of the healthcare system, I would say 80 to 90% of the healthcare system is in the metros and the cities, and the very, very little healthcare is available in the semi-urban and rural areas. And those are the areas that need to be strengthened. Now, as an emergency measure, we need some people now, we need some beds now. What we can do is we can sort of dip into our reserves, which is people who have finished their MBBS, are waiting to take their entrance exams, or waiting to go abroad, or just leaving for the NEET. Those can be sort of taken in with some incentives, both for their future and for the current work that they're doing, and ask them to be employed in the COVID care centers or in the COVID care hospitals under supervision. So also we can take a large number of nursing students. There are a huge number of nursing colleges, people who have graduated or final year graduates, and even from the teaching cadres like MSc Nursing, you can use them. So also there are a large number of foreign medical graduates waiting to get an equivalent degree in India. And obviously with some quick training, they can be used at least in a supervised manner, and at least for teleconsults during this crisis. And many people other than the medical, pulmonology, intensive care and emergency care should be roped in for the care of COVID patients during this crisis times, maybe from anesthesia. People who have any intensive care background, be it surgical, obstetric, or any other fields, orthopedics. I've had a lot of orthopedic surgeons volunteer to work in the COVID ER or ICUs. So anyone who has taken care of sick patients, irrespective of which field they're in, should be roped in as an emergency to take care of these patients. We should also look at people who have recently retired. Unfortunately, retirement age in India is very, very young still, sort of 58, 60, which is very young in the current context. They should be roped in. And certainly we should use people from the armed forces as a temporary measure to help us out during this crisis. But skilling and increasing the number of professionals has to be a long-term plan. What we can do is emergency measures to tide over the crisis based on what we have told you. And this has been done in the US, UK, and other places. They have taken interns, they have taken people who are not in the field of medicine to rope in and help them out with the COVID care. So we can do the same. So it's not something new we are doing. And certainly look at the future to meet our needs. We need to increase the number of training centers, number of training facilities. But the biggest challenge for us is not the number of doctors alone, but the inequitable distribution of doctors. Take it whereas it is cities versus rural. There's no dearth of doctors. In fact, before Corona came in, one of my colleague called me and said, Dr. Ballal, you're doing disservice to us by training so many nephrologists. There are too many nephrologists in the city, we have no work. So everyone is in the city, no one goes to the periphery. And we have similar inequitable distribution. Let's say Karnataka has enough number of doctors, nurses, but you go to some of the other states like Bihar, Uttar Pradesh, Chhattisgarh, Madhya Pradesh, you hardly have any medical colleges and doctors. So there is not just a matter of numbers, it's inequitable distribution too that needs to be addressed. So these are something that the planners should start looking now. Now, obviously, they have taken healthcare as a prime subject. It was given a lot of importance in the current budget. Hopefully, this trend will continue and we won't be lulled by complacency after this pandemic withers down.
Dr. Ballal, I think the last but one question, and it's a very important one. With the current situation where there is a scarcity of beds, oxygen, any sort of medicines, any medical supplies, how do the frontline workers manage this, the expectations of often very angry patients, patient relatives? It's a system that has the scarcity. However, it's often the brunt of it is faced by the doctors and the frontline workers. And what, in your opinion, is a better, slightly longer-term way of dealing with this situation? We have already seen some very unfortunate incidents being played out in different parts, incidents that involve borderline violence, violence that is taken place against medical professionals. Would like to hear your thoughts and advice on that, please.
Yeah.
Thank you.
And there's one part of the previous question that I probably left unanswered, is how do we sort of bridge the rural-urban divide? And to me, digital health is one mode of doing that. And we have seen that in the past. Digital health, whether it is teleconsultation, e-ICU, so on and so forth, has really sort of bridged the divide, not entirely replaced rural healthcare, but has helped it. To give you one example, the government of Karnataka, along with Manipal and Columbia Asia, which is of course now our family too, started a program where our intensive respiratory physicians and emergency room doctors had an e-consult, teleconsult, and an e-ICU with each district headquarter hospital of Karnataka. So nothing changed. The personnel were the same. Infrastructure was somewhat similar. They just sort of discussed, and we have done tens of thousands of consults over the last many months. And there was a dramatic change in the mortality. The mortality decreased by 50% after we started this concept of e-consults between our headquarters in Bangalore and district headquarters hospitals in the rural areas. So I think it made a huge difference. Similar things, I don't think we should forget digital health once the pandemic is better. I think we should use that, because that will solve some of the divide between the rural and urban areas, though not a complete one. We should also look at having nurse practitioner, physician assistants manning some primary healthcare centers, because it'd be impossible to get a doctor, and even if you get a doctor, it will be difficult for them to be posted in primary healthcare centers, because it's just not the primary healthcare center alone. It's also what the environment, connectivity, what is the life you have there. So I don't think overnight we can send doctors and dump them into the primary health centers. So we should have a plan of running these with nurse practitioners, physician assistants, which is done in the US too. I mean, most of the primary care is now done by nurse practitioners and physician assistants under the supervision of a doctor. So I think it is doable, and some of the nurses who are trained are extremely good. They can manage the situation quite well, and obviously with e-consults and physical movement to a bigger center if it's necessary. And the second question is the question of violence against doctors, which gets exaggerated in a pandemic situation, because there are a lot of sick people. You cannot attend to all of them, and sometimes, unfortunately, because of no fault of yours, maybe lack of infrastructure, lack of oxygen, lack of medicines, lack of space, patients might die, and the relatives get irate, and actually they might indulge in physical violence, which we have seen not to a large extent in this part of the country, at least where I live, but I have read a lot of reports. Here, I think 2 or 3 things are necessary. One is the government should come down heavily on violence against healthcare workers and healthcare facilities. They should go to jail irrespective of what happens. They should be arrested. This is a cognizable offense. And there are laws to say that if you assault a doctor, nurse, or the healthcare facility, you go to jail. And that has to be implemented with full vigor, but it's not totally a law and order problem. We need to create awareness. And one of the biggest problems we have seen during this pandemic is that the triaging system has failed. What happens is when the patients run from hospital to hospital, and they can see their relative deteriorating during this movement from hospital to hospital, gasping for breath, and then finally stopping breathing, they're angry at the world. And whichever hospital they land in, they'll be angry that the hospital is not able to take care of them. But the hospital's hands are tied. Where do you take a patient when there are already 10 people in the ER corridor who are intubated? Where do you take this person? So I think an effective triage system where the patients don't run, but the triaging person or the triage center tells you which hospital to go, which ICU to go, and then the patients won't get so angry. If you say you go to this hospital, there's a bed there, they won't get angry. They're angry when they bring a sick patient and the hospital turns them away, or they die in the ambulance, or they have to go from hospital to hospital. So some of this can be managed. Of course, the oxygen system was quite critical, and I don't blame anyone for that. There was a 10-time increase in the oxygen consumption of this country in a matter of weeks. No country can be prepared for this. And the government has effectively now diverted all industrial oxygen. Of course, there were some initial problems on the logistics of transportation of the oxygen from production units to the rural and the remote areas of India. But I think that has been pretty much taken care of. Now you don't see so much of oxygen shortage. And also the numbers are coming down because of the measures taken in the lockdown. So some of these things, I think, for the future need better planning. And as far as assault on healthcare workers, I think more awareness of the patients, better triaging system, and a strict implementation of the law and order situation by the government and the police is the only remedy. And also the healthcare workers, for this critical work they're doing, should have some special allowance and special insurance that is guaranteed for them, either for succumbing to the illness or being admitted and treated for the illness, or for against any physical violence. You're muted, I think.
Sorry, I was on mute. This question has come in from one of the live listeners. Very poignant question. How do we deal with the guilt feeling for not being able to help some of our patients?
I think this is what I mentioned earlier. I feel guilty every day. Hundreds of calls coming with the patients I know are going to die if we don't give care. And unfortunately, we are not able to accommodate them. And that is certainly a guilt feeling and a depressive feeling for me. And unfortunately, we have to adapt to circumstances. We can only do our best, but we cannot cure all the ailments of the world or this country overnight. So we'll do our best. That is the satisfaction I have. If there is a bed, I will not deny it to someone who's sick. If there's a bed I can make by moving someone else who's not very sick, I'll make that. But if there are absolutely no beds, making a bed means killing someone else, then obviously it's beyond my control. So I think we'll have to wait for the pandemic to come down. And I think here's where the counseling helps. Counseling, talking to each other, having groups. And also, I think it is important to sort of get off of your work for a short period of time. Continuous 24/7 working in this kind of a stressful situation will only aggravate it. Your performance will come down, you'll get more depressed, you become despondent. So those are things we need to avoid. One of the important things that I must mention is during the first pandemic, there are a lot of nurses' families. We have a huge workforce, predominantly of young women working as nurses, and their families were very concerned. And obviously, we would be too, if you're going to send your young daughter to a far-off place, and then you have this ugly, bad pandemic, corona that shows up, they would be concerned. So we actually had teleconsultations and video conferences with the family in the presence of the nursing staff, where we assured them that we'll keep them as safe as possible, and we'll make sure if they fall ill, we'll take care of them. And our attrition rates actually came down quite a bit. Of course, I must compliment the nurses who sort of withstood the onslaught of corona, but we also made the families more comfortable. And this is where dialogue helps. I think we have to be on the same page, meet, talk, express yourself. And if you have some guilt feelings, come out with it. Talk to your colleagues, talk to your mentors, talk to a counselor, talk to the management, but somehow don't keep it inside so that it boils out and then you lose control.
Thank you, Dr. Ballal. I think we are almost dot on time. So any thoughts, suggestions, Dr. Ballal, you would have for NatHealth, the community as a whole, to really come together? And is there something, of course, a lot of ideas will come out of these, forum discussions over the coming weeks and days. Any suggestions you'd have for NatHealth to kind of pursue this course with the multiple stakeholders that are in our network?
No, I do believe NatHealth is a significant force of planning and delivery of healthcare in the country. And now it's led by very, very able people like Dr. Mahajan as president and Sudarshan, US Secretary General. I think what we really need to do is look at the planning for the future. I think we should work with the government, and we already have a large number of private health sector people in NatHealth. I think we should work together in planning the healthcare for the future, not only for routine things, but also face the pandemics of corona or any other virus, and the pandemic of the non-communicable diseases, which are waiting to erupt. It's like a rumbling volcano. So we have to plan for the future, and this should not be very siloed. I think it should be right from primary healthcare in the rural areas to secondary care, tertiary care, quaternary care. I think this is something that we have to plan. It cannot be done by one man, one person. And I think certainly there is enough brain power in Nat Health to help the government in this planning. And I'm sure Nat Health speaks. Certainly they will listen, because what we would say is with scientific backing. So I think Nat Health has a huge role to plan for the future of healthcare of the country, and also would have a huge role in pushing digital health and also skilling, because we need skilled people to run our healthcare system. So planning, digital health, skilling are the three things that I can think of on the top of my mind. But there are many other things that Nat Health is already doing and will continue to do. I wish Nat Health all the very best. And you guys are doing a great job, and I'm sure you'll continue to do this.
Thank you, Dr. Ballal, a lot. Dr. Mahajan, I would like to hand it over to you, sir, for your closing remarks. Thank you.
Thank you very much, Siddharth, and thank you, Dr. Ballal, for really deep insights as a soldier on the front. And also, we've had a very, very good response from audience that has joined in. And frankly, from Nat Health, I can say that we will be always there to do whatever we can in our own limited way to help, especially the frontline workers, overcome all the problems that they are facing, both physical, mental, familial, all of these. And I'm sure that what we discussed today and what we are going to discuss in the future will become a repository which we can delve into anytime we need wise counsel and wisdom and come up with solutions for problems that we are facing. So thank you very, very much, Dr. Ballal, for being the opening batsman, if I may use that term, in our quest to learn from frontline workers and to help in whatever way that we can. Over to you, Siddharth.
So thank you both, Dr. Mahajan, Dr. Ballal. It's been a very, very insightful, introductory session to this series that we are creating. Tomorrow we will be having the privilege of having Dr. Arvind Lal from 11:30 a.m. will be our next speaker. So for those of you who are listening, I would request you to please send your questions. We will prepare for tomorrow's sessions. Each of these sessions will be transcribed. The key questions will be put out in a blog format. And hopefully that's going to be useful for many, many frontline workers who could not join today. And we'll find a way to kind of get it across to all the frontline workers over time in partnership, with not only through Nat Health, but also in partnership with all our federations with whom we closely work with. Again, thank you for taking the time today, and we hope to see you soon tomorrow and look forward to continue this dialogue ahead. Thank you again. Bye-bye.
Thank you, Dr. Mahajan. Thank you, Siddhartha, for having me here.
Thank you very much.
And thank you to a wonderful audience.
Thank you.